So today, a very important topic which a lot of women, almost all women, they keep thinking about it. And one would like to know whether she is ovulating or not. Now, what is ovulation and why it is important? Why you want to know about it? So basically, ovulation is a process where the egg is released from the ovary and it enters into a fallopian tube where if by chance intercourse happens at that time and sperm meets the egg in a particular part of the fallopian tube, then fertilization takes place and then a joint structure that is zygote is traveled is traveling to the endometrium or uterine cavity, and here that is how the pregnancy starts. So to make it easier diagrammatically, I'm trying to explain you. So you can consider this is a uterus, this is vagina, and this is uterine cavity. Two fallopian tubes are attached here to the upper part of the uterus, and it is open inside the uterine cavity. And this is one ovary, this is another ovary. So both the ovary contains very high number of the eggs. The number of the eggs are fixed when the girl is born. The number of the eggs are fixed, and every month, once she starts ovulation, every month it is getting depleted with the increasing the age. So with the each advancement of the age, the number of the eggs are decreasing, and once when the total number of the eggs remain around 1,000, then there is a menopause. So today we would like to know how ovulation occur and what is ovulation. So with each initiation of the cycle, these eggs become larger and larger. Couple of eggs becomes larger, and not all. Only one egg becomes dominant and becomes large, and at the mid of the cycle, this egg is liberated in the peritoneal cavity. Now, this fallopian tube has got fimbria. So, because of the fimbrial movement, this the current is generated, and this egg is attracted or dragged towards the external opening of the fallopian tube, and it enters inside the fallopian tube and it gradually travels. Now, when intercourse happens, the sperm is liberated and deposited around the cervix. The sperm has got millions of sperm. So those sperms who are active, they they ascend upwards, enter into the opening, enter into the fallopian tube, and here the sperm and egg meet, and the zygote is formed, and this zygote travel back to the uterus and try to get attachment and embed into the lining of the uterus, and this is how the pregnancy starts. So you can understand the ovulation is very vital procedure if one would like to avoid pregnancy or achieve pregnancy. So suppose someone wants to avoid the pregnancy, she should avoid having intercourse without contraception during a peri-ovulatory period. So, what is peri-ovulatory period? The likelihood of the ovulation, that is called peri-ovulatory period. Now, once this egg is released, this the fertilizing capacity of the egg is retained for nearly 24 hours, but it remains highly fertilizable for 12 hours only. Whereas sperm, once it is released, it retains the fertilization capacity up to 48 hours. But highly fertilization capacity is 24 hours only. So if they make an intercourse when the ovulation process is occurring, if one want to avoid pregnancy, she should avoid a intercourse at least 2 days before the likelihood of the pregnancy and 2 days after the likelihood of the pregnancy. Now the question comes, how to predict whether ovulation has occurred or not? One would like to know about the ovulation because either she wants to avoid pregnancy or she wants to become pregnant. Now, any couple, they are practicing intercourse every day or every alternate day. But suppose they have not practiced intercourse around the time of ovulation, then all the efforts go in vain and the woman cannot become pregnant. So that is why to know the whether cycle is ovulatory or anovulatory is important. Now, how to predict whether ovulation has occurred or not? How to judge whether ovulation has occurred or not? So, one is regularity of the cycle. Second is length of cycle. So, these are the two important uh, predictive point which gives fair idea whether C is ovulating or not. If the cycle comes at regular interval, most of the cycle, around 80 to 90% of the cycles are ovulatory, but not necessarily all the cycles should be ovulatory. But you can have reasonable idea that this woman may have a ovulatory cycle. Second, the length of the cycle. The woman having cycle length between 21 to 35 days of length at regular interval is predictive of the ovulatory cycle. So we can predict the ovulatory cycles from regularity of the cycles and length of the cycles. Now, what are the other tests? Suppose one want to be very precise about the ovulatory period, then most practical way, of course, it is not a very perfect way, But still, a practical way is to know the safe period, or you can say the ovulatory, to know the ovulatory period. So how to predict? Suppose the woman has got 28 days cycle, then a likelihood of pregnancy is on 14th day. But suppose the woman has got 30 days cycle, then likelihood of ovulation is on 16th day. So whatever is average cycle length, you have to reduce 14 days. These 14 days are called a luteal phase, luteal days. So from the cycle length, average cycle length based on previous 6 month record, you have to deduct 14 days. That is the most predictive day of the ovulation. So one want to achieve pregnancy, she should practice intercourse 2 days before and 2 days after, continuously, preferably, or if not continuously, at least alternate day. So this is the time where likelihood of the pregnancy is very high, fecundity is very high. So in other words, if the ovulatory predictive ovulatory day is 14th day, 2 days before, 2 days after. So this is, if one want to avoid pregnancy, she should avoid having intercourse between 10 to 16 day. But still, if you want to be more safe, you can add 2 days before and 2 days after. So one should avoid intercourse between 10th and 18th day. The woman can easily avoid pregnancy. And if she wants to become pregnant, she should have at least daily or alternate day intercourse between these days. But this does not stand true for every cycle, because in spite of the regular cycle, many cycles are anovulatory cycles. So you have to take little broader period if you want to really avoid pregnancy or achieve pregnancy. So this is a third method how we can judge. Fourth is LH kit, or you can say ovulation kit. What happens before ovulation? The LH hormone, which is secreted from the pituitary, is peaked. The level is highest, and following which the ovulation occurs in next 24 to 36 hours. So this LH is excreted in the urine. So there are special kits which are available to measure the LH surge. This high rise in LH is called LH surge. So woman has to add 2 to 3 drops of urine in this well and observe for next 2 to 3 minutes. If the second line only occurs, second line always comes unless the test is invalid, then it is negative. But if the first line also comes and second line also comes and both are equally dark, then this is a positive test. That means LH surge has occurred. So one can expect ovulation in next 24 hours. In next 24 hours, the ovulation. So if you want to achieve pregnancy, next 24 hours are most important days. 24 to 48 hours are most important days for the conception. So this is, but here again, it is not very precise. Approximately 20 to 25% cases, the results is not accurate. So one may prove wrong if one rely absolutely on LH kit. Then if you want to become more precise, then you have to measure serum E2, serum progesterone, and serum LH level. So this is quite expensive and tedious, but this is something we need to do, especially when we are offering the patient ART treatment or the treatment with IVF treatment or IUI treatment. Sometimes we need to do this test for the better prediction of the ovulation. This is expensive and we need not go into detail. You being a patient, you need not know too much about the levels and other things, which is quite important for doctors, medical doctors. So apart from this, what are the other way? After the ovulation, the progesterone level rises because this progesterone is secreted from this the follicle. Once the egg come out, then the follicle is converted into corpus luteum, and this corpus luteum secrete progesterone. And progesterone hormone is important for conception, pregnancy, and maintenance of the pregnancy. So this progesterone peaks, and if the progesterone level in the blood is measured, and if it is more than 6 nanogram, it is predictive of ovulation. It is to be measured 7 days before. So you can say if it is a 28-day cycle, on 21 days, it has to be measured. And if it is more than 6 nanogram, it is suggestive of ovulation. So these are the different practically used tests. Once upon a time, we used to measure the temperature. So basal body temperature we used to measure. Normally after the ovulation, the body temperature rises little bit because of the under the effect of progesterone. But this is gives a lot of fallacy, and now we no more rely on the basal body temperature. We either uh, we either rely on LH kit or we rely more on progesterone. So these are the two tests apart from the regularity on length of the cycle. So this is uh, clinical test, this is urine test, and this is progesterone as a blood test. So these are the three tests by which we can predict whether ovulation has occurred or not, and which is very vital to know the ovulation has occurred or not. Now the next question comes, which are those conditions where ovulation does not happen very regularly? So the most common annuulatory, it is called annuulatory cycles. So most common reason for annuulation is PCOS, polycystic ovary. Second common reason of annuulatory cycle is pituitary insufficiency. And third common reason is ovarian resistance or aging. So these are the commonest reason apart from thyroid and prolactin, high thyroid level and prolactin level. So these are the common reason apart from the normal variation. See, out of 12 cycles you can see in a year, two cycle can be an ovulatory cycle, 1 to 2 cycle can be an ovulatory. So it is a normal variation. An ovulation is normal variation. But apart from that, the PCOS, hypopituitarism, the perimenopausal problem, or you can say diminished ovarian reserve or ovarian resistance is another reason, and thyroid problem as well as the prolactin problem. So these are the common reasons where the ovulation is hampered. So if we can predict the woman to be anovulatory, we can easily investigate and guide them and make them ovulatory so that her goal of achieving the pregnancy is attained. I hope you have liked this video, and we will keep updating about newer different topics in very lucid and understandable language. Thank you so much.